welcome to Solutions for Seniors. I'm Linda Pellerin, the Executive Director of the Shepherd Center of Charlotte, and we're glad to have you here today. The Shepherd Center is an organization for seniors in the community, and we have programs and services for them to help keep them active and engaged, and we offer fellowship for them. And this program is primarily to educate the seniors on some of the things available for them in the community that'll help them get on with their lives. And so this is October, and one of the primary things that we come across in October is because we are a seniors health insurance information program counseling site, open enrollment is a big thing for us, and that means open enrollment for Medicare Part D. And open enrollment this year starts on October 15th, and it goes to December 7th. And what you want to do is, if you use prescription Part D, or you want to start prescription Part D, then we advise you to please call the Shepherd Center, 704-365-1995, and set up an appointment to come in and talk with one of our volunteer counselors. What they can do is look at the current plan that you have and compare it with other plans out there, and make sure that you have the plan that's most effective for you, most cost effective for you. And you may say, well, I've had the same plan for the last 5 years and it's fine. But a lot of times the plans change every year. And one of the confusing things is you're probably getting a lot of mail, especially from the last few months. You've been getting a lot of mail from insurance companies saying, hey, come use us for your prescription Part D plan. So if you're as confused as I get with all of that, because I get that mail too, not for me, but for my husband, if you're as confused as we get, then you'll want to come in and talk to one of our counselors. Now, along that line, the Seniors Health Insurance Information Program, it actually was started in North Carolina by the former insurance commissioner, Jim Long. He started it, and when it proved to be so successful in North Carolina, other states picked it up. So North Carolina was the so-called flagship program for the whole United States, and so we're very proud to have that. And part of that program, part of the Seniors Health Insurance Information Program, or what we call SHIP for short, is the Senior Medicare Patrol, and that's primarily what we want to talk about today. We have Maria Romeo with us, and she is a volunteer with the Seniors Medicare Patrol. And Maria, what is that really?
The Senior Medicare Patrol is volunteers that in the community that go through a program, and the program is to help us to go out and educate consumers, caregivers, anyone that gets Medicare, and just teach them about abuse, fraud, and how to properly look at your Medicare statements, and just to be well educated about the whole Medicare system.
Now, when you talk about abuse and fraud, I mean, that can come about in a lot of different ways. It can come from the doctors, it can come from the clients, it can come from the insurance companies. How do you present this to seniors?
Well, one of the main things is that we're all inundated with papers. We get papers that are statements that come from the doctor's offices, we get statements that come from Medicare themselves, we get statements from our secondary insurance, and the discussion on how to keep all your papers in order is most important. A lot of times, someone will just gather them all up, and a lot of times there's duplicates, and the most important thing is to just maintain all your papers, and a great strategy for that is to just have all that input into mymedicare.gov and utilize that so that you know what things were covered by Medicare, what things your secondary insurance has picked up, and what you can expect to have to pay if there's anything that's out of pocket. The one thing that a lot of people don't do is they keep all them, but they don't compare, and they just end up paying all the bills, and then sometimes that can be very costly. So we try to make sure in our education that a person will look at each one of those documents, their summary of their services that were rendered to them, the estimated benefits that they will receive from Medicare, and then on top of that, what their secondary has covered. That way that there's no extra billing, leaving no way for them to have extra costs that they may have to pick up. So it's a big thing, and that's where a lot of fraud and abuse comes in, because people don't pay attention to that, and sometimes there's double billing and other
So if
problems.
there's double billing and the senior ends up paying because they don't know not to, I mean, do they ever get reimbursed?
You can go back to your insurance company and ask them. Most of the times they will catch it if it's an insurance thing that you've paid your insurance company twice. We always say go to your provider first, have the discussion. But that's the great benefit about SHIP. If you feel uncomfortable and you don't want to go to your provider to ask those questions, the SHIP volunteers are there, and they're volunteers, and they're looking out for the betterment that there is no abuse of that system. So you want to utilize them. They're your free advocate to help you to be able to not have these excessive bills or overpayment or excessive charges that you may or not have had or received.
Right, and I know exactly what you're talking about because a few years ago I had major surgery, and of course I'm not under Medicare. I just had an insurance provider, and all this stuff. I was getting statements from the doctor's office, the surgeon's office. I was getting statements from the hospital, the anesthesiologist, and they were all coming in, and I'm like, well, isn't insurance paying for all of this? And they don't always say this is just a statement, or sometimes they don't say on it, this is not a bill, and it gets very confusing. I'm lucky in that I just turned it all over to my husband and let him deal with it because I was busy I was busy getting better.
Getting better, exactly. Exactly.
So, and this is the sad thing is that a lot of this stuff comes in when the senior's recovering from maybe a debilitative disease or illness. Maybe they've had, hip surgery or knee surgery or something. You don't want to be dealing with this stuff.
Right.
So what other things, what can a senior, what should they be looking out for as far as, let's just say, fraud?
Well, one, you want to make sure that you look at all the statements that you received, and that the statements come from either the physician's office or the other services that you had done. So if you have a procedure done, you want to make sure that the doctor's name appears on that statement, and where the office was, and or the hospital or outpatient site that you received those services. Sometimes there are some ancillary ones like lab work and things that may come from another location. Double check and make sure that that physician's name or that physician's practice is carried through on every single one of those statements. Another part of that would be is to when you go in for it, you ask your physician, what procedure am I receiving? And you can always ask them after you get the bill as to, is this the procedure that I received? A lot of times people don't know. They think that they went in for one thing, and people are human. They may code it incorrectly. There may be some issues. It may not be that they're trying to commit fraud or abusing the system. They're just someone, had a bad day and didn't code it correctly. But it's always good to double check and make sure that the services that you received were the ones that you actually had done to you. An example of a fraud would be something for a service that you never received, or for medical equipment that you did not get. Or another example may be other things that someone may have tried to bill under your Medicare card that never happened to you. So always pay attention to dates, because the date that the services took place always appears first on that. And pay attention to those physicians and people that you got the services from. Those are very key important things when trying to decide, am I getting charged for services that I didn't want?
Now, is Medicare fraud and abuse prevalent?
Oh yes, very much so. Different parts of the country a lot higher, which is kind of staggering. In the state of Florida, it's probably higher than drugs. But 68, I want to say billion in taxpayers' dollars around that has had fraud related to it. So it's a big, big ticket, and it's one of those things that seniors are vulnerable. So individuals get that number because someone will give it to them, and they go to town. It's unlike everything else. If it's something is given to you for free, there's usually a catch to it. So realize that no doctor's office, no person that's ringing your doorbell is giving you something for free because you're giving them the Medicare card. Medicare is not free, nor is the services that you receive from Medicare free, or equipment or any of that. So that's where the biggest amount of fraud
Just
happens.
think of this. If there wasn't all this abuse and fraud, Medicare could be free.
Yeah, it could be. It could be. That's very true. And that's the other problem too, is that people feel like it is, and once they get into the system, and hence the other reason why it's so important to get that evaluation from a SHIP counselor, is that depending upon what services you need, what your medical conditions are, the cost for you to be in the Medicare may vary. Mm-hmm. So it's really important to evaluate that. And if you do find, through this process that you have increased the amount of drugs that you're using from last year to this year, those are reasons why you want to be able to have an evaluation of the current Medicare that you're in.
Right. The plan that you have.
Evaluate the plan.
Right. And part of that is, well, of course, you can, if you're brand new to Medicare, and I'm speaking, as a SHIP counselor myself, if you're brand new to Medicare, you can sign up. It's 3 months before your birthday, mm-hmm. the month of your birthday, and then 3 months after your birthday. It's better, though, to sign up the 3 months before, anytime in the 3 months before your birthday. And that's when it's best to decide, what plan you want, and your prescription Part D plan. Many people, and baby boomers are now aging into retirement, and they're aging into 65, and many of them are healthier than 65-year-olds were, say, 20 years ago, and so they're going into Medicare not taking any drugs at all. Mm-hmm. And so they look at that and go, hey, you know what? I don't need prescription Part D because I'm not taking any prescriptions. But what they don't realize is the longer you wait to sign up for Part D, you actually get penalized, and you have to pay that penalty every single year. So if you're watching this and you're getting ready to sign up for Medicare, get a Part D plan. Just get the cheapest one you can get, and pay the very nominal fee, which is maybe like $10 to $15 a month or something. It's better to do that than have to pay a penalty for the rest of your life, because if you're like me, and I am a baby boomer, if you're like me, you're planning on living to be 130. So you don't want to be paying that for the rest of your life. Now, this also brings up the question, both my parents, I mention them all the time on this program because they're in Vermont and they can't see it, and so they can't yell at me for mentioning them all the time, but both of my parents are 87. Okay. And I try to keep an eye on, what's going on with their health and everything. And every once in a while, my mom will have to mail me some of her paperwork so I can take a look at it and make sure. She is not very assertive when she goes to a doctor and she gets medication. She never asks what it's for. She never asks, she doesn't ask the critical things. She doesn't ask, is this going to interact with anything else? She just assumes that these doctors know everything that she's taking. And she assumes, well, if the doctor says I should take it, she never questions anything. If the doctor says I should take it, I'm going to take it. And constantly, I talk to her and I say, oh, well, what are you taking? Oh, well, I don't know. I just know I have to take it 3 times a day. And I really don't know what it's for. How involved should the children of seniors be in, how involved should they be in their parents' health and in what's going on with their Medicare and everything?
Well, just as you would want everything else when it comes to your financial situation, you would want someone else to if you don't feel comfortable enough to oversee your bills and how, what's happening to you, it's always good to have someone as an advocate. If you don't have a family member that's close by, that's another part that someone can do for you, just to look at and do the comparison. Children sometimes can be more savvy than their parents, and a lot of times I'll suggest that someone establish an account on mymedicare.gov for someone to be able to have access to that. For a classic example, I just went yesterday with my mother to her doctor's appointment, and the doctor asked all these pointed questions of, when did you have your last colonoscopy? When did you have all these things? And mymedicare.gov allows for someone to have the opportunity to know exactly when those things that are covered through Medicare as preventive measures, when your due date is for it. So the other part of it is that helps to cut down on the amount of abuse and fraud to the system, because if a doctor says to you, oh, you need to have a colonoscopy, and he doesn't know that you had one 6 months before, you can go to your mymedicare.gov and check out the date and when those services were performed on you. So that's another thing, is that maybe a doctor will not know you as well because he may be a specialist and you might have had that services done. And it's always good to double check. It's always good to keep a list. And we provide in our training session a great little book. It's called the Personal Care Journal. And as an advocate for making sure there's not a lot of abuse and fraud of the Medicare system, I always tell people that that's the one thing that you should gravitate to. Take this little book. It's only about this big. Take it with you, have either your family member or yourself jot down the date of the services, who the doctor was, what procedures you had, and that way you can use that journal as a comparison to the papers that you get in the mail from the statement of estimated benefits, whatever statement you get from that, from your Medicare summary notice. You can do a comparison so you're of what actually happened. The other part of it is, I don't remember at 44 that things are when I had procedures done. It's just a good log, and if someone is not cognitively impaired, that also helps them, the family member, to maintain their well-being, because they can go back to this summary document and they can read when things were done and to continue that. So I always think if someone can be there for you and be your caregiver for the care receiver, they should, and they should also look at all of your papers and all the things that have happened to you and really keep a good record of that.
So it's really a good idea for seniors to have some kind of an advocate, whether it's someone in the family or a close friend or something that understands these things. And it's probably a really good idea for children of seniors to get involved in all of this, because trust me, you're going to be there one day, and you might as well learn it all now, and then you won't have to worry about it later. And by the way, colonoscopy is probably not a really good example, because I think I can pinpoint to the day the last time I had one. So those are things you tend not to forget.
Tend to forget, yes, very true, very true. But with that also, I think, when you say that, if you're talking about someone who's 65 years old, who's just getting into the Medicare system, it's always a good thing to have an education, even if you're younger. Even if you're 20 years younger, going to a class on Medicare and understanding all the parts, A, B, C, D, the alphabet soup, you should know all that. To be a better consumer for your family member, you want to know what A covers, what B covers, what C covers, and definitely D, because there's so much out there and it changes every year. And in this need for cost savings, it's important to reevaluate that. Go back and go to your SHIP counselor and reevaluate that every single year, because life gets in the way and life changes. And to sustain ourselves to being 100 years old, that is an intricate part of it, to make sure you just take the time to do that.
Right, and we are very lucky that the government has Medicare.gov that you can go to.
Sure.
So if you're computer savvy at all, you should be going there anyway. I go to that website a lot just to, look up things. I'm out speaking about that a lot and everything. And, it is possible also to go to the SHIP website, which is, for North Carolina, it's www.ncshiip.gov. And go to that website. There's, a lot of information there. Go to Medicare.gov. You can plug in you don't have to go to a counselor if you feel like you're savvy enough, or if you want to check things out for an elderly parent or even for yourself. You can go there and plug in your information. And like you said, if you go to mymedicare.gov, the information is there for you to track and everything. So that's always a very good
And that's
thing.
an important thing too. I always find that when I have this discussion with someone, they say, "Well, I have Blue Cross and Blue Shield, and it's one of the many providers," and it's not the smartest thing to just keep things right there, because you're using your secondary insurance, you're using your Medicare insurance, and that the MyMedicare.gov tracks everything, and you can put in your Blue Cross and Blue Shield stuff as your secondary, but it just keeps a record of it. I find I forget, and I forget how much was covered this time, or what my deductible is, and as you get through other things like costly prescription drugs, you really want to pay attention to that, so you can keep a record of your whole year and what's been going on with you. So
yeah, just very, very good things. What are what we talked about fraud? What about abuse?
Abuse, sometimes I think a lot of people think it's a fraud and abuse, kind of, there's two separate things. Abuse would be someone that steals your card, steals your information, and is just abusing the system in itself. They will call up on the phone, they'll steal stuff out of your mailbox, that kind of stuff, and they will intentionally, without you knowing, abuse your card. So that, of course, if you feel like that's something that's happened to you, if you do go to my Medicare.gov and you find that there is something that's so out of the ordinary that you would never have had that done, that's a great one to have somebody else look that up for you. Report it. If you detect that there's abuse to it, report it. And whether it was positive or negative, the outcome, it may be that nothing was abused and you just didn't remember something. But if it was, then it's saving the government obviously some money, because then they can prosecute that person. But it's always important, when in doubt, just report it. It's not a bad thing to do.
Well, how do you report it?
You can either go to one of your SHIP counselors and ask them, tell them about it. Call your healthcare provider. You can go online to the SHIP website too and let them know about it. The more people you let know about something when it comes to your Medicare card, the better it is. And like I said right from the beginning, it may not be that someone's trying to abuse your card. It may just be a clerical error that someone has done. So, don't always think so totally to the left. It may be something simple like the person put a 2 in instead of a 1, but.
Right. So they're using like the wrong Medicare number or something. Yeah.
Right.
Well, how can seniors guard their Medicare cards? What are some good ways for them to keep it so that, so others can't get their numbers and everything? Well,
you treat your card as if it was a credit card. You always want to, not give the number out. If someone calls you on the telephone, and asks you for it. I know a lot of times when you are making an appointment with a doctor's office, they will ask you for either your Social Security number or your Medicare number. And for a doctor's office, that's how they track you. So when they're asking you for it, it's because they're looking for you in their system. But if a man comes to your door and tries to sell you a pair of orthotics, that's a different story. Medicare, people who are that have Medicare abilities to bill Medicare for their services do not come door to door. So that's a very important thing to realize, that you want to trust that number and you don't want to just give it out to anyone. Same thing with your family members. You want to make sure that your family members have the rights to be able to use your Medicare card. You want to make sure that they sign a HIPAA agreement at the doctor's office so that they can be your advocate if you don't feel comfortable with it. You can protect yourself by having those things in place. Nowadays, they will ask when you go to the doctor's office, is there anybody else? Can you sign this piece of paper that says, is there anybody else that I can give this information to? And it's really important that you allow someone in your family, if you are not cognitively aware of your whole situation. You want to have somebody else do it for you. But protect it. Don't just give it to anybody. And just make sure that it's something that's not out there. You can keep it in your wallet, but if you don't, you always want to present it when you go to the doctor's office, because they're going to ask you for it to make a photocopy of it.
We've just got a couple minutes left. What about the internet? What if somebody's trying to maybe buy drugs on the internet and it says that, Medicare covers it or something?
I would be hesitant with that, in the fact that you just don't know if somebody's phishing, as they call it, on the internet. A lot of times you go back to your healthcare provider and say, where can I get this medication? There's so many reputable pharmacies that it should not be that you have to search that way. But I would always double check if you can physically go to the place versus just sending it in the mail. It's definitely a good idea not to do it that way.
So don't give out your Medicare card over the internet,
Definitely
because
not.
that's probably the worst thing you can do.
That's right. Protect it.
Definitely. Any last thoughts for seniors?
Really important to keep a record, maintain a record of all services, all medications, all things that you have as part of your daily life. Keep good records, because when it comes to the time when you can't do it all yourself, you want to be able to pass that down to somebody else that can. Attend classes, educate yourself about the Medicare system, the different plans that are out there, and just be an advocate for yourself, and tell your friends not to always be afraid, but also just to be an advocate for them too. It's important to just do that for yourself. It's a tricky system, but it's a manageable system if you just put the right tools in place.
Right. So some websites that are going to be very helpful is www.medicare.gov. Now, is the My Medicare, is there a link off of Medicare.gov? So you can go to Medicare.gov and then link to My Medicare. And also, like I said, the North Carolina SHIP website is www.ncship.gov. And you can get a lot of information from that website as well. Have questions, call the Shepherd Center, 704-365-1995, or go to our website, www.shepherdscharlotte.org. Well, Marie, I want to thank you for coming out today and discussing all of this. It's complicated, I know, but it's information we need to get out there, and there is help on the way. So thank you all for joining us. And next month we have Officer Craig Allen with the Charlotte-Mecklenburg Police Department talking about senior shopping safety. Thank you. Look forward to seeing you next month.